Hi, I'm Barry Strasnick, Chairman of the Department of Otolaryngology here at Eastern Virginia Medical School. For the past 30 years, I've had the privilege to be associated with this department and witness the transformation of this department from a regional resource to its current status as a national acclaimed and recognized program. This evolution, if you will, has in large part been due to the hard work and success of our faculty, residents, and students. The clinical programs and research activities of our department have established the framework and foundation for us to be able to develop a culture that expects clinical and academic excellence. I feel that probably one of the proudest parts of our program is the focused dedication of our faculty to the support and training of the next generation of otolaryngologists.
Probably about half of our residents over time have gone into general otolaryngology, but have been generalists who take care of everything that walks through the door, and that's because they get such good training.
We kind of have all of the different facets of otolaryngology covered in our staff, and that kind of trickles down to the residents for their training.
You know, if you wanted to train students, you're able to help train students. If you wanted to get involved in leadership, or if you wanted to get involved in research clinically in the lab, you're able to.
One thing that's maybe unique to ours that I love about the program is our incredible endocrine volume. As ear, nose, and throat doctors in this area basically do all of the thyroid and parathyroid surgery in town, and as a result of that, we will graduate with quite literally hundreds of cases.
So this temporal bone lab is brand new. Our attendings each year try to bring different people in. We've had guest speakers and work on different techniques, and so even though it's the same it's the same information that you're trying to capture year to year, but your skills keep getting better each year, and each year there's a new different technique.
But I think we see a lot of difficult airway. I think we're very good at dealing with them both acutely in the emergency department as well as chronic long-term airway stenosis problems. So I think we have great airway training here, and that's something I would definitely want to brag about.
As residents, we provide care in various practice settings. So there's Norfolk General and the main hospital at CHKD. They're huge campuses. We have multiple ORs going at any one point, but it's also nice to be able to put the pager down and go out into the middle of Virginia Beach to an ambulatory surgical center, and all of our faculty are operating at those as well.
It's a unique program because we don't have fellows, so if you're a PGY 2 or 3 on that pediatric service and we have an airway reconstruction, it's you and the attending doing it. So I think you get a little bit more of a hands-on experience, especially with some of these more involved procedures. So I think that's an advantage to our department and the training that we provide to our residents.
We have the head and neck team, which will have multiple residents on it. We have facial plastics and rhinology are a team together. We have otology and laryngology as a team together, and then pediatrics is another team. And so we'll have multiple residents on each of those teams, varying from chief residents down to junior residents. With this approach, the residents really do get a lot of continuity of care, follow up on specific patients that they've interacted with, and get to see them from coming to a consult in the office through the operation and through recovery, and can really kind of see that process move along.
There is dedicated didactics for our residents once a week, and every attending teacher in our department takes turns running the didactic session.
In the end, if they go into general private practice, any patient that walks in their office, they should be able to know how to take care of and what to do for them. Even if they don't practice that type of surgery anymore, they know exactly what to do. So their clinical acumen is fantastic when they leave here.
As we continue, we're always learning new things as new people come in and new different techniques and approaches. And so it's been a really wonderful place to learn, and we have wonderful attendings that we have great relationships with. We usually have a mix of people going into general and fellowship, and we have wonderful help from our faculty and mentors to help us to get those fellowship positions so that we can jumpstart our career and kind of start our junior career doing already like the specific part of ENT that we love.
As far as the program goes, I think that we are a really great, well-rounded program. I think you would be hard-pressed to find another place that has such good training while also having such good camaraderie with not only my colleagues as residents, but my attendings as well.
For resident doctors that are looking to be involved with research, we have lots of opportunities. We have basic science research, we have clinical research, and so plenty of ways to get involved and participate in some really exciting, innovative research in our field. We have a lot of NIH funding. We have funding from both the institution as well as funding from the American Academy of Otolaryngology. We have clinical trials that are industry funded, so we really just have the gamut of projects that our faculty are involved with.
I think at first we were doing a little bit of bench research, but now we've really expanded that to do a lot of clinical research as well. EVMS has kind of gotten put on the mark in the world because of all this clinical research that we're doing.
Every one of us in the pediatrics division is involved in research at on one level or another. We all have kind of areas that we try and focus in, but we're also involved in regional and nationally with research as well. That all kind of filters down to experiences for the residents to have as far as getting involved in research.
During that time, we do ask them to write a core grant, so I think it's a really great opportunity for them to learn how to write a grant and to really understand, the process that leads up to that. We're open to any project that the residents want to do, so we have residents that have projects that when they come in, they have an idea of what they want to study, but there are many residents who join us who don't have an idea, and so we're able to help them cultivate that. Publications, grant funding, all of those opportunities are here, and so I think the residents that join us for our department will be very pleased with the research experience.
Our referral base comes from all the way from North Carolina to Eastern Shore, as well as far as Roanoke and Harrisonburg. So we have patients driving like 6-7 hours to come and see us because the referring physicians who are from those areas know the type of clinical care that we're giving to our patients, so they're driving many distances away.
I think the goal of any healthcare institution is to provide excellent care to patients. EVMS does that, I think, in many ways, but at the core of it, we have a heart for the community and the community here in Norfolk.
This medical school is from the community, for the community, and we take that out as well in doing things like head and neck cancer screenings, international medicine, taking mission trips and things like that, and just thinking about how we can impact our community, those people that are around us.
Overall, otolaryngology is one of the surgical fields where we have a better balance of women and men. Our department is no exception. 6 of our current faculty are females, and over half of our residents are females. So we're a very equitable department in terms of everyone's role in the department. Our medical school is very inclusive, and that trickles down and trickles up to the residency programs. There's a lot of diversity in our area, and that's reflected in our faculty.
Women, I think, tend to look to residency programs where women are represented as faculty, but also an environment that's very open and supportive of women in medicine. I think we do that pretty well here. So we have a very strong women in our administration at EVMS at all levels. We have a lot of female medical students, a lot of women residents, a lot of women in general surgery. As far as that goes, I think it's a very welcoming and supportive environment for women.
I chose to come to EVMS because I wanted an institution where I knew that if I were going to succeed or fail, it was going to be because of me and not because of the institution and not because of the bureaucracy that's brought by the institution.
Our faculty, our staff, our other residents are all very supportive, and we want people that are excited and eager, people that are hardworking and devoted to excellent patient care, and if that's you, I think we can make you into an excellent otolaryngologist here at EVMS.
Not a lot of people know about Virginia Beach and Norfolk, but everyone here is so nice and it is so beautiful. 10 months out of the year, we have great weather. It rarely snows. The beach is awesome. There's mountains nearby. The food is great. I think the population here is incredibly diverse.
Our culture, I think, is phenomenal. The residents love to spend time together. We often take use of the amenities we have in the area. We go to the beach together a lot. There's a lot of tennis playing in the program right now, a lot of golfing together. So I think we are lucky and we are fortunate how much we get to both work hard and play hard with each other.
All the attendings have an open door policy. You can approach any attending at any level that you're at and talk to them, even if it's a personal problem or anything, that we have a very warm, inviting residency program. It lends itself to a fantastic learning environment. And our residents who have graduated still call us, still talk to us, and they still interact with the previous residents. It's really a close-knit group, which is very unique, I think.
One of the big reasons why I decided to stay is just I felt that the people here were very invested in me, invested in my success, and so I felt that that's pretty important when you're trying to do this kind of grueling training. People that are invested in your success, not just academically but personally as well.
Anyone can thrive here as long as you come in and work well with others and just want to support your co-residents and want that environment, you'll do well here.
What's important in any residency program is the development of a culture that supports education, supports development, supports career mentorship, if you will. And my role as chairman is to be a facilitator for all of those common ideals. Many people don't realize that we are the largest training program in the state of Virginia, both in terms of faculty as well as clinical volume. We have the largest volume of head and neck cancer in the state of Virginia. We have the largest otology volume. We're the only freestanding pediatric tertiary care center in the state of Virginia. We now have a new mental health facility that's being developed that will support that. We've combined that with a robust research experience and an aggressive didactic experience for the residents. But more importantly, I think, is the relationship that we've developed between the residents and the faculty to allow an interchange of educational experiences that keep the faculty fresh, quite frankly, that we always need to stay on our toes and be able to know that we're at the forefront of education and forefront of knowledge that we can impart to the residents. I hope we've had the opportunity to provide a short glimpse into the programs and academic activities that are available here in our department at EVMS. Certainly, the patient care and research programs are second to none. I'm hopeful that you'll also be able to see that our dedication to the development of learners and lifelong learners is something that we take very seriously here in our department.